Rheumatic fever causes swelling and scarring inside your heart. This can permanently damage your heart valves and is called rheumatic heart disease. The damage may be mild and cause no problems. It may be a bit bad, meaning you're not able to play competitive sports or do all the things you want. Or the heart damage may be really bad, meaning your heart can't cope with the extra work and you need heart surgery to fix or replace the damaged valves. You can get rheumatic fever more than once, and every time there is a chance that it can make the damage to your heart worse. That's why it's very important you protect yourself against strep bugs, so that you don't get rheumatic fever again. There are several things you can do to help protect your heart. Have your injections on time, every time. Get sore throats checked. Look after your teeth. Be smoke-free. Be a healthy weight, and keep active. The injections. Penicillin kills the strep bugs that trigger rheumatic fever. You can protect yourself and your heart by making sure that you have your regular penicillin injections on time, every time. Each injection gives you enough penicillin to fight the strep bugs for up to 28 days. This means you need to get another penicillin injection every 28 days, like a top-up, so that there is always enough penicillin in your body to stop you from getting rheumatic fever again. If you miss an injection, your body will run out of the penicillin and it won't be protected against strep bugs anymore. You could get strep throat again, which could lead to more rheumatic fever and heart damage. If you forget an injection, contact your nurse so you can get your next injection as soon as possible. This means that if you go away on holiday or move house, you need to let your nurse know so you can arrange to have your injection early if needed, or if you can get your injection elsewhere. The injections are given by your nurse in a muscle near your bottom or hip. They can be painful, but your nurse can help to numb the pain by adding the numbing agent lignocaine to the penicillin and using ice or the buzzy. Thinking about other things, blowing bubbles or watching a video can also help reduce the pain. Remember, you need a penicillin injection every 28 days to stay protected against strep and stop more heart damage from rheumatic fever. To help you remember, write a note on your calendar, your fridge, or anywhere else you'll see it. Set up a reminder on your phone. Ask your nurse to text you a reminder, and ask your family or whānau to help you remember. Do not stop your injections until your heart doctor says it's okay to stop. For most people, this means you need to have your injections every 28 days for at least 10 years. Some people need it for longer to help protect their heart, especially if they have bad heart damage or got rheumatic fever when they were less than 11 years old. Get sore throats checked. Remember, another strep throat can cause another attack of rheumatic fever. If you or anyone in your household gets a sore throat, you need to go to the doctor or nurse as soon as possible to ask for a throat swab to check for strep. If it is a strep throat, you'll be given antibiotics to kill the strep bugs. It is important to take the antibiotics for the complete 10-day course to kill all the strep. If the antibiotics are stopped early, the strep bugs come back. Look after your teeth. Everyone has tiny bugs in their mouth. Some are good and some are bad. Sometimes, bugs can get into your bloodstream. If the bad bugs reach your heart, they can cause an infection on the valves damaged by rheumatic fever. This is called endocarditis. You'll be very sick, need to go to the hospital, and stay there for weeks. You can look after your teeth and help prevent infection by using your own toothbrush. Don't share with anyone. Brushing your teeth twice a day, every day. Bad bugs don't like living in a healthy, clean mouth. Use fluoride toothpaste to make your teeth strong. Not eating lots of sugary food and sweet drinks. Bugs love sugar, so you'll end up with lots of bad bugs in your mouth. Go to the dentist or dental nurse every 6 months. If rheumatic fever has damaged your heart valves, you may need an extra dose of antibiotics before you have your teeth cleaned, or before you have an operation. Ask your rheumatic fever doctor or heart doctor about this. They will give you a special card as a reminder for you and your dentist. Tell your dentist and every nurse and doctor you see that you have had rheumatic fever. That way, everybody can work with you to protect your heart. Be smoke-free. Smoking and second-hand smoke can damage your heart and blood vessels even more. If you're trying to quit smoking, there are stop smoking services you can go to for free help with your quit plan. Be a healthy weight. Lots of people find it hard to keep a healthy weight after having rheumatic fever. Early after an attack of rheumatic fever, you may have to stay in bed and rest. This gives the heart time to heal and get better. But after spending so much time being looked after in bed, it can be easy to pick up unhealthy habits and gain too much weight. It's important to stay at healthy weight because extra weight puts extra strain on your heart. If you gain even more weight, then your heart must work even harder to pump the blood around your body. It is bad for hearts that have been damaged by rheumatic fever to have to work so hard all the time. If you are finding it hard to keep a healthy weight, ask your community nurse or your doctor for some help. Whether or not you find it hard to keep a healthy weight, you need to eat well and keep active to help your heart cope with the damage from rheumatic fever. Your heart is a muscle that pumps blood around your body, and just like other muscles in your body, activity keeps it healthy and strong. That means walking, going upstairs, or running. You can do more and more activity as your heart gets stronger. Your doctor will tell you what you can and cannot do. The amount of activity you can do will depend on the time since the attack of rheumatic fever, your blood tests, and how much your heart was damaged. Ask your doctor what you can do, and then do it. There is a lot you can do to be healthier, especially if you've had rheumatic fever. Protect yourself and your heart by having your injection on time every time. If you or anyone in your family have a sore throat, get it checked. Look after your teeth, be smoke-free, be a healthy weight, and keep active. A healthy heart is a happy heart.